Pulse, vital sign explained in simple words. Hello everyone, welcome to my YouTube channel. Today we're talking about one of the most basic but life-saving vital signs, the pulse. If you're a medical student, this video is for you. Let's get started. What is pulse? Pulse is the rhythmic expansion and contraction of an artery as blood is pumped by the heart. In simple terms, every time your heart beats, it pushes blood through your arteries, and that pressure wave is what we feel as a pulse. It tells us a lot about a person's heart rate, rhythm, and sometimes even their overall circulation. Fun fact, you can feel the pulse in different parts of your body, and each tells a story. Pulse points. Now, where can you check the pulse? Here are the major pulse points. 1. Radial pulse at the wrist, most commonly used. 2. Carotid pulse in the neck, used during CPR. 3. Femoral pulse in the groin, used in trauma or shock cases. 4. Brachial pulse, used in babies. 5. Dorsalis pedis and posterior tibial on the foot, used in diabetic foot checks. Used to fingers, index and middle, never your thumb, because it has its own pulse. How to measure pulse? To measure the pulse, place your fingers gently over the artery. Count the beats for 15 seconds and multiply by 4, or count for the full 60 seconds for accuracy. You'll note, rate, how many beats per minute BPM. Rhythm, is it regular or irregular? Volume, strong or weak? Normal adult resting pulse, 60 to 100 BPM. Athletes may have lower, children higher. Abnormal pulse. Abnormal pulse findings can give early warning of serious issues. Tachycardia, pulse greater than 100 BPM, can mean fever, dehydration, anxiety, anemia, or heart problems. Bradycardia, pulse 60 BPM, normal in athletes, but can mean heart block or hypothyroidism. Irregular pulse could suggest arrhythmias like atrial fibrillation. Thready or weak pulse, seen in shock or blood loss. Bounding pulse, seen in fever, anxiety, or aortic regurgitation. Pulse in clinical practice. Pulse is checked in emergency rooms, ICU monitoring, general physical exams, before giving medications like beta blockers or digoxin. It's the first sign we check in unconscious patients. Is there a pulse? If not, we start CPR immediately. So that's everything you need to know about pulse. Simple, powerful, and life-saving. If you learned something new, please like the video, share with your classmates, and subscribe for more clear, simple medical content. Comment below, what topic should we cover next?